Hello, everyone. Welcome to the December JHS Speaker Series session. Hope everyone is well, whatever time of day that you're calling in from. So as with all of our previous Speaker Series sessions, if you have questions along the way, you're very welcome to submit them in the right-hand side in the chat box there. And myself and Pinar will be monitoring them. We keep it private so that it's not too distracting for our presenter. But you're very welcome to submit questions. And today we're very happy to be joined by Aileen Simon. She is the project lead for strategic initiatives at John Howard Society Ontario with their Centre for Policy and Research. And she's going to be speaking to us about their Civil Legal Needs project. She'll be sharing results from the team's preliminary research and the needs assessment conducted on the unmet civil legal needs of JHS Ontario's justice-involved population. Hi, Aileen. Really nice to have you.
Thank you so much. I'm happy to be here.
Yeah. I'll hand it over to you. Thanks so much.
All right. Sounds great. Thank you for that wonderful introduction, Liz. As Liz mentioned, I'll be going over our research project today, which culminated into our report, which we released earlier this year in the summer. That report has the same title as the slides here, Legally Bound, addressing the civil legal needs of justice-involved Ontarians. And that report is available on the John Howard Ontario website. So I certainly would encourage you all to go check it out. It'll kind of give you a better idea of the things I'll be talking about today, because I'll just be providing a summary, but there's also some summarizing documents on there as well if you don't feel like going through the whole report. And essentially what this project was, if I can just give a brief overview, was that we received funding from the Law Foundation of Ontario to conduct an in-depth research study of the civil legal issues facing justice-involved individuals in our province, and the barriers preventing them from getting those legal needs addressed. So essentially, like as Liz said, what this was a needs assessment. And what we wanted to do was identify some of the most common civil legal issues that our clients were facing, and the types of information that our staff, as well as other community workers, might be able to benefit from to respond to those issues. So I'm going to start today just maybe by going over some key concepts that we use in the report and defining those, just to contextualize the information a little bit more. But then I will jump to the research itself and summarize some of our key findings. And then I'm going to finish up by talking about some of the things that we've been doing more recently to translate these findings into actionable items, and where we plan to actually go with this report and with this project now that we've released the report. So like Liz says, I will stop for questions throughout, and I certainly encourage you all to ask them. I'm happy to go over anything. It will just be me talking. So it'll also, I guess, give you a break of my voice and have Liz pop up and ask some questions. So why don't we get started on the concepts? And the first two that I want to go over are these ideas about civil legal issues and civil legal needs and the difference between them. So what we refer to as a civil legal issue is an issue that can be resolved through a formal legal process that is not a criminal law issue or a prison law issue. And with justice-involved individuals, these civil legal issues are often things that relate to their basic needs. So if I can give you a few examples, something like being evicted from a rental housing unit, having issues with child custody or other family law matters, wrongful dismissal from employment, issues accessing the public education system, so something like a suspension or an expulsion. Those are what we would refer to as civil legal issues. Now, civil legal needs, on the other hand, we define those, as you can see on the slides here, as the requirement for timely, accessible, and responsive legal services, advice, and resources to address those civil legal issues. So essentially, if I can put it in a sort of summarized fashion, a civil legal need is created by a civil legal issue. And so they're very intertwined, but different things. And when these issues and needs are left unaddressed, we see that it leads to things like further marginalization, It contributes to poor socioeconomic conditions. It increases their likelihood of recidivism, and it can cause further legal problems, or what we refer to as these compounding, intersecting, and overlapping legal issues. And I'm going to touch on that a little bit more in a moment, but I do just want to go over one other definition, and that is the idea of a trusted intermediary and what that means. And so we know and we define trusted intermediaries as those who have a deep understanding of their clients' multidimensional and intersecting needs. And they also have the best understanding of their clients' unique circumstances that they face. And so oftentimes this will be a frontline social service worker who has earned the trust of their clients through that effective relationship building and through that long-term engagement, because they're seeing clients more frequently and often in moments of crisis. And because they're seeing clients more frequently and in those moments of crisis, it puts them in a really great strategic position to act as a bridge to accessing legal information, legal services, and legal resources. And I'm going to come back to this idea of trusted intermediaries acting as a bridge in these situations in a little bit, but it's just to note that frontline staff, including our John Howard staff, have this unique role with their clients. And they have this unique role in their clients' lives where they get to help them in those moments and often at those pivotal times while they're experiencing these civil legal issues and other issues in general. So they're very well positioned to help clients identify legal problems, but also to potentially detect other legal problems that they may not be aware about. And this can help make sure that clients are receiving correct legal information, receiving timely access to legal services if it's something that requires a quick response. That's really great to have that trusted intermediary there. It can also make sure that problems aren't compounding into more serious legal problems or causing additional legal problems, which again, I'm going to come back to that in just a second. But I do just want to put up a quote here on the slide, which I think gives a really great example of this idea of a trusted intermediary and the role that our frontline staff, as well as other community workers, play in their clients' experiences with these civil legal issues and in their lives in general. So it says here, our facilitator asked the individual whether there was someone or an organization that they use when they're experiencing civil legal issues. And the respondent here, as you can see, says, my go-to is the staff here at John Howard because they're here and I trust them. And that having that trusting relationship was really important to them, and that they can get that help directly from frontline staff. So this idea of having a trusted intermediary acting as a bridge is really important to our research and sort of things I'm going to be going over today. It's a really central focus of this research and the next phase of our project. And I think just to keep that in mind as we move forward. So now that I've covered those definitions, I am just going to turn to the research here and summarize some of our key findings. So maybe I will just start by going over our research methods as well as some of the demographics of our research participants, just so we can contextualize the findings and this information. So actually, I might just take some water because I feel like I'm talking nonstop. Okay, so for this project, the data was collected and analyzed using exploratory and descriptive designs, and we used a mixed methods approach. So we did things like surveys, one-on-one interviews, group interviews, and focus groups. And we recruited a bunch of different participants, but included clients from our local John Howard offices, as well as staff from our local John Howard offices in Ontario, and some stakeholders from community legal aid clinics across the province. And we surveyed our clients for their perspectives on their civil legal issues and how they deal with them. And we wanted to survey frontline workers to get a better understanding of their understanding of the civil legal issues that their clients face, as well as how we could best leverage their position as trusted intermediaries to help their clients with those issues. And lastly, we talked to staff from community legal aid clinics about their relationship with organizations like John Howard and other community organizations, and the civil legal issues of justice-involved populations, as well as how we could create a sort of holistic approach to addressing these issues. So we can see from the numbers here on the slide that the justice-involved population we surveyed had a pretty diverse demographic profile. I'm just going to point out a couple things, though. The majority were between the ages of 18 to 44, and a majority of our participants identified as male. In terms of income, we see that approximately half made under $22,000, and that point's important only to make note of. So when it comes to legal aid financial eligibility requirements, income is a key part to that. So I just want to make note of that here. And the last thing I'd like to draw everyone's attention to is the incarceration statistics. So only about a quarter of the individuals that we surveyed had previously experienced a period of incarceration, but most of the respondents indicated that they had not been incarcerated, even though that they had been involved with the criminal justice system. So maybe they weren't serving a custodial sentence, or maybe they hadn't actually been in custody, but they had interacted with the criminal justice system in some way. And now that I've kind of covered some of the research methods, the introductory info, I think we can now turn to the findings. I'm only going to highlight some of the key findings, but like I said at the beginning, I certainly encourage everyone to check out our report and to see all those findings with a little bit more in-depth explanations. I'm just going to turn now to, okay, so our first finding here that I want to talk about is that justice-involved populations experience particular civil legal issues in particular areas of law more frequently than other types. And so what we did here was we asked staff and we asked clients to rank the issues that they experience most frequently. I have the two different charts here. I want to start with the justice-involved individuals on the left, so the blue-looking chart. And as we can see here, when we identified some common civil legal issues for the justice-involved individuals related to housing, income maintenance, family law, and employment, they identified housing issues as being by far the most common issue that they face, and then followed closely by things like income assistance, income maintenance, employment, and family law issues. But what you can see now, if we turn to the statistics from the frontline workers, is that there are actually some similarities in their responses. So the graph on the right here, the lighter one where it's for frontline workers, we can see that they were also asked to rank various civil legal issues based on how frequently they occur. And again, housing came up on top as being the most commonly identified, and followed by employment, family law, and income. Now, what's interesting about the survey responses on income maintenance related civil legal issues is that during our focus groups with frontline staff, they also identified housing related issues as being by far the most experienced civil legal issue. But unlike their survey responses, they also identified income maintenance issues as occurring more frequently than employment issues and family law. So even though the survey responses were a little bit different, there was some form of consensus among justice-involved individuals as well as the frontline staff that we surveyed that housing and income maintenance issues seem to occur the most frequently in justice-involved populations. And there are, of course, other civil legal issues that these individuals will face, but those four are definitely the ones that came up most frequently in our research. The next finding that I want to discuss is the different way that justice-involved individuals experience civil legal issues compared to the general public. So I've listed some of the differences here on the slides, but what you can see, so if we start with the general population, when they're experiencing civil legal issues, this is often on a one-off basis. So it's sort of a sporadic situation. But if they are experiencing multiple civil legal issues, those issues are often unrelated to each other. And the issues that they are experiencing aren't typically interacting or intersecting with criminal justice issues, which is another key difference. And the last difference that I want to just point out is that members of the general public, particularly affluent members of the general public, will typically access legal services quickly enough and on an as-needed basis to respond to those civil legal issues. So maybe it's something like a divorce proceeding, a real estate transaction, a small claims matter. It's typically these one-off things that they're having these interactions with the civil justice system, and then they're getting that legal advice or legal assistance as necessary when those things come up. Now, if we contrast this with justice-involved individuals, we can see that the way they experience civil legal issues is a little bit different. Their issues are multiple, overlapping, and compounding. And this is one of the biggest things that came out of our research. And also the idea of them being a direct consequence of or made worse by criminal justice involvement. And I think one of the best ways to explain this, if I can give an example, it's sort of like a domino effect where one problem can trigger another. Or in some cases, the problems can be so intertwined that it becomes difficult to stop something from happening if another thing has already occurred. So if I can give an example that would maybe sort of explain that a little bit better. Let's say you have an individual who's receiving government income support and they're taken into custody. And because they're taken into custody, they lose access to that income support, which then leaves them unable to pay their rent in their rental housing unit. And if they're unable to pay their rent, they could then be evicted from that rental housing unit, which could then lead to, say, for example, child custody issues if they have any children. So that's just one example of what this might look like for a justice-involved individual experiencing a civil legal issue. But that's what we mean in our report when we talk about multiple intersecting and compounding civil legal issues. It's kind of like dominoes falling over. And the other thing I want to point out is, so unlike the general public who is seeking advice and assistance with their civil legal issues as necessary, justice-involved clients are typically using non-legal methods to resolve their issue, and they're not typically seeking help from legal professionals. So maybe that means that they're trying to resolve it on their own, they're asking friends, maybe they don't actually know that they're experiencing a civil legal issue, or they're simply leaving it unaddressed if they do know, because they don't know how to deal with it. And, they aren't accessing help from those legal professionals in those cases. So those are just some of the key differences that I wanted to point out between justice-involved individuals and the general public's experience with civil legal issues. But the other thing I do briefly want to touch on is, and I think it's really well encapsulated by this quote, we had a frontline staff member who said this, and I think that this quote is really helpful to explain. And it's about this idea of the tyranny of the moment, and talking about how clients want what is quick and easy and what they need now. They aren't always thinking about their legal needs and the other things that are going on. And frequently, justice-involved individuals will experience these moments of crisis or these tyrannies of the moment, where all of these things are happening concurrently and all the dominoes are falling at the same time. And if a justice-involved individual needs assistance in those circumstances and they give up and just leave the problem unaddressed, it goes back to what I was saying before, this idea of further marginalization. It can contribute to poor socioeconomic conditions. It can lead to recidivism and reincarceration. And so this really shows the very kind of stark distinction between how the general population will experience a civil legal issue versus a justice-involved individual. And now that I've covered that, and we've taken a look at which civil legal issues they experience the most and how they experience them, I do just want to turn now to some of the barriers that these individuals will face when it comes to addressing those issues. The first one that I want to talk about is a difficulty recognizing when they are experiencing a civil legal issue. And this is one of the biggest findings that came out of our report, and I do want to touch on it a little bit more in a moment. But it's just to know that there is a lack of awareness there that can be creating a barrier. The other thing that came up is a lot of the individuals we spoke to and surveyed, they did not view the issues they were experiencing as legal issues. So a lot of them normalized these behaviors. They perceived it as being inevitable and acceptable. They thought it was just their lot in life, and it was theirs to deal with. But if they were recognizing that the problem was a civil legal issue, there was also issues around a perception of these issues not being as serious as a criminal legal issue, or they had such distrust due to their criminal justice involvement that they would avoid the civil justice system entirely, even though there might be a remedy available for their particular issue. So this is just a kind of a brief summary of those critical barriers, but I do want to touch on that first one a little bit more in depth. And this is this idea of awareness, or a lack of awareness in being able to, justice-involved individuals not being able to identify or recognize civil legal issues. And the way that this finding actually came up was through scenario identification, which you can see here on the slide. And essentially what we did was we tried to gauge our client and our frontline staff's ability to correctly distinguish between something that is a civil legal issue versus something that is a non-legal issue. And so we came up with 4 scenarios describing different issues related to housing, family law, income maintenance, and employment. And we asked the participants to identify which of these, if any, described a civil legal issue. And so you can see them here on the screen. And just for context, the first 3 scenarios would fall into the category of a civil legal issue, and the 4th about needing assistance to apply for subsidized housing would not constitute a civil legal issue. And we can see from the percentages here that with the exception of the first scenario about the boss firing the person and not paying them for work that they'd already done, a large percentage of the justice-involved individuals that we surveyed either incorrectly identified the scenario or indicated that they didn't know whether the scenario described a civil legal issue. And if I can contextualize this finding a little bit, even though we did get some of these responses, and it was encouraging to see that some of them were able to actually correctly identify a civil legal issue, a large percentage of them actually misidentified the scenario or couldn't answer the question. And that really reinforced our understanding of this need to increase awareness among justice-involved individuals and whether the particular issues that they're experiencing are in fact a civil legal issue. And what's interesting here as well is that this there's a significant proportion of respondents who were not able to correctly identify the civil legal issue that they were experiencing. But those same respondents, many of them said that they did have knowledge and awareness of when they were experiencing a civil legal issue and when they needed assistance with that issue. So you can see the contradiction in that, and that there's a serious disconnect wherein people might be experiencing a problem that they don't realize is a civil legal issue because they're not correctly identifying it as such, and then incorrectly assuming that they don't require legal assistance. So this is, of course, one of the biggest barriers to individuals accessing legal services. That was why it was on the top of the list on that last slide. And that ability to get those legal services and information quickly when it's necessary. Because if they're not recognizing a problem as something that might have a legal remedy, then they won't seek out the information or advice from a legal professional. So again, this is one of the most crucial findings in our report, and it really goes back to the idea of our frontline staff, as well as other community workers, as trusted intermediaries, acting as that bridge for their clients to help them detect those problems, help explain to them that there might be a remedy or a solution to their problem, and then pointing them in the direction of advice or information to assist with it. And encouragingly, actually, on that point about trusted intermediaries acting as the bridge, our frontline staff that we surveyed were better able to distinguish between these scenarios. So they received similar scenarios and were asked to distinguish between them as well, which ones were civil legal issues and which ones were not civil legal issues. And most correctly identified the first two scenarios, so the employment scenario and the family law child support payment scenario. They identified those as civil legal issues. And most were able to identify applying to subsidized housing as a non-legal issue. And even though, it was very encouraging to see that our frontline staff had indicated that they know when clients are experiencing these civil legal issues, I will just note that about 40% of them indicated that they didn't know when clients were experiencing civil legal issues. So there is somewhat of a gap there and an inability to identify those civil legal issues on both the justice and involved individual side as well as our frontline staff. So they're both facing that barrier in some way. And of course, that can be a problem in responding to these issues and avoiding those compounding or intersecting legal issues, avoiding the rest of the dominoes falling over if there is that lack of awareness. And I'm just going to put up this slide here with this quote because I think it's a really great example of some of those barriers that we just talked about. So you can see a respondent here talking about being evicted by their landlord for not paying their rent. And the facilitator said, if you didn't move out and wanted to stay, who do you think you would have asked to help with that issue? And the respondent says, I would think I would have to move because it's his place. And when the facilitator followed up asking if there was anyone they thought they could ask for help, the respondent said, no, I never even thought of that. I just thought that once they said you have to go, then you have to go. So again, this is a really great example of some of those barriers we've talked about so far. There's that inability to recognize that the issue is a civil legal issue, which might have a remedy available to reverse the problem, not knowing that he could stay, not knowing that he didn't have to move out or they didn't have to move out, and not imagining that as the end of the conversation. But it's also a good example of a justice-involved individual having these feelings that come up about it just being their lot in life and it being something that's inevitable. They say that I think I would just have to move out because it's his place. And as if they need to accept that as something normalized. And the last thing that I think this is a really good example of is that a justice-involved individual, as you can see from this example, they are not seeking that assistance from a professional legal service in this scenario. And this is particularly true if they're not identifying the civil legal issue that they're experiencing. So obviously there can be a disconnect there, and that's perhaps why this person did not seek legal assistance, because they weren't in fact identifying the issue as a civil legal issue. But I think it's a really good example of how some of these barriers kind of all come together. And it really kind of showcases how these problems affect our clients in a real life scenario. So I just wanted to have that quote there. The next finding that I want to talk about is, now that we've covered a lack of awareness and some of those other barriers, I do just want to look at why, when a justice-involved individual does identify a civil legal issue, they aren't seeking assistance from professional legal services like a community legal aid clinic to get help with that issue. So back on that experience slide where we compared the general public to a justice-involved individual experiencing a civil legal issue, where the general public was seeking help when they realized they were experiencing a civil legal issue. A justice-involved individual typically was not seeking help, and they weren't seeking help from a licensed legal professional. So we wanted to look at why. And we can see from the findings here, as you can see on the slides, there was a belief that they didn't require assistance with their civil legal issues. And that was the most commonly cited reason for not seeking assistance from a professional legal service, such as a community legal aid clinic. I do just want to contextualize that finding because, as we know, there's a lack of awareness issue. And so, again, they might not be seeking assistance. because they're not recognizing or identifying that problem as a civil legal issue. So that could go to this finding here. But I also want to look at some of the reasons down the list. This idea of a lack of information, not knowing the services legal aid clinics provide, not knowing how to contact legal assistance, not qualifying for legal aid. Looking at that information, we can see that further work is needed to better inform justice-involved individuals about how to access community legal aid clinics and knowing what services those clinics can provide to them, as well as any financial eligibility requirements that might go along with that. And although we have the information on this graph here, it's from our survey responses, but we also had one-on-one interviews with many clients, and they were able to kind of elaborate on this issue further. And they talked about things like the process of getting help or looking for help being really time-consuming. They also talked about being shuffled back and forth between different organizations or different resources, and the idea of like being forced to wait a long period of time once they did get to where they needed to be. They were forced to wait a long time to actually get help. And those responses in those interviews become even more concerning when we think back to what we talked about before, what that frontline staff pointed out, this idea of the tyranny of the moment, or these moments of crisis that we kind of talked about previously. So those delays and that confusion in those cases, in those scenarios where you have a client who's experiencing a moment of crisis, if you have those delays attached and that confusion, it can be a major impediment to them receiving help if they require timely assistance. So if you think like as an example, if it's something that has a really quick deadline or something that requires immediate action, for example, an eviction, if someone receives an eviction order, that's something that requires a very quick response. And if they're not getting access to those legal resources, that legal information quickly, it becomes even more concerning. And I also just want to point out to one of the reasons here on this chart, the lack of information. So it's just up top underneath the dark blue line. And we can see lack of information is also a really big problem. And our research confirmed this too, that there's a gap in knowledge and information that is directed at justice-involved individuals and their civil legal issues. So there's lots of really great resources for individuals to use to help them address their civil legal issues out there, particularly low socioeconomic populations. At least in Ontario, we have lots of resources for people who do want to self-represent themselves or, deal with their legal matters on their own. But our research showed very little to no resources, which were focused specifically on the civil legal issues that justice-involved individuals were facing. And because we know that their experiences with these issues are so different from the general public, there's really a gap in information and knowledge available. And that's sort of where our project is kind of stepping in to try and hopefully fill that gap. But before I get to that, I do just want to briefly touch on how our frontline staff as trust intermediaries can act as that bridge and try to reduce some of the barriers that we've been talking about today. And on that note, I just want to move over to the next slide, because although our frontline staff can act as that bridge, they also identified barriers that they face in effectively helping their clients navigate these issues. And I just summarize them here on the slide. They identify 3 common barriers to prevent them from effectively connecting their clients to legal services and resources, which then in turn prevents them from accessing those services and resources when they need it. And the first one is issues around comprehension of legal information, which goes back to things like a lack of awareness on how to address a civil legal issue, difficulty in assisting a client quickly when they are in those moments of crisis and needing quick access to resources or advice. not knowing where to refer clients, which offices do what, or having concerns around giving the wrong information. That's something that came up as well. Of course, our frontline staff are cautious on their role of not being legal professionals and not wanting to give legal advice and not wanting to cross that line. So there were concerns with that. And, those are things that came up in our conversations with them as being one of the bigger barriers in this work. The next thing that came up was difficulty with navigating the civil legal system. And this makes sense. It's of course, it's so vast. It's so different. There are so many different bodies, administrative bodies, tribunals, courts, and they all operate differently. They all have different timelines. They all have different procedural requirements. And it's not as sort of all-encompassing as the criminal justice system that operates in one system. The civil legal system is divided up into different parts. And so it can get very difficult to navigate. And our frontline staff wanted more assistance with navigating that system and all of its differences. And the last thing that came up was this urgency for a program to provide direct and immediate assistance. And this is because our frontline staff did indicate that they felt pretty confident identifying when clients were facing a civil legal issue, but that they wanted training on how to spot and address those civil legal issues. And they also wanted training on how to make referrals to professional legal services, because they really believed that their clients would respond most positively to receiving legal information and legal advice from a legal service provider. And so they wanted training on how they can make those referrals and what things they needed to keep in mind. Even with these barriers, we got some really encouraging results from our frontline staff from all across Ontario, who really showed a great interest in learning more about their clients' civil legal needs. As you can see here, they were interested in learning about the civil legal needs of their clients. They said, I'll just on the second one about having time to learn about the civil legal needs of their clients. There were concerns about, resources, staff levels, time constraints, things like that came up. But as a general consensus, the staff really felt confident in helping their clients address these civil legal needs if they were going to be provided training, and they were interested in doing that training. And I will note in particular, a preference for online training was made, which frontline staff could do on their own time and just have accessible to them because they are so busy. And of course, their schedules can fluctuate. So having something that was online that they could access was the preference. And also staff showed a really high desire to collaborate with community legal aid clinics in their area and desire to strengthen that relationship with those clinics and with the staff working at those clinics, which was really great because when we talked to stakeholders at community legal aid clinics, we also had staff from there who were really interested in also collaborating with frontline service providers and, meeting with them and learning more about the work that they do and vice versa, maybe conducting public legal education activities in those offices. And it was really focused on creating a more holistic approach to addressing the civil legal issues of justice-involved populations by creating more a better relationship between the justice sector and the social services sector by creating those relationships, and both seem to be very interested in that. So I know I've been talking a lot. I will just take a brief pause to answer any questions if there are any. That's sort of a summary of the research, and I'll talk a little bit more about what we're doing moving forward. But maybe if there are any questions, I can answer them. If there aren't, I can continue. Oh, there's Liz.
Hi, everyone. Just really encouraging you to submit your questions via the chat box on the right. I think what you've presented so far, Aileen, is so captivating and is really crystallizing my thinking about this. So I really appreciate it. And as I was kind of pulling my thoughts together, I was so pleased that you preempted what my question was to be around how does staff feel about this? How confident does staff feel in navigating the civil legal system, knowing where to get resources, knowing the role that they play in being that trusted intermediary and sharing information to service users? It's a delicate balance, and you're right. There's, I totally identify with the fear of providing the wrong information or advising someone who is in a vulnerable position with outdated information or the wrong information. So it's not only being confident, but also being current and having those relationships with, like you say, the community legal clinics. Yeah, so interesting. Thank you.
Yeah, no, it's a really great point to point out. I think our frontline staff, which was really great, they wanted to get this knowledge and they wanted to help, and I think they were interested in doing so as long as they felt confident in the information that they were giving. So you're right to point that out. It's a huge thing, and so I will talk about that a little bit more in terms of what we're doing with the project going forward in a few minutes. But I'm happy to kind of take any questions before that.
Leslie has asked, I think she may be preempting what you're going to speak to next, but will there be training rolled out across Canada?
I can sort of answer that now. I will be talking about it in a little bit, but it's not necessarily going to be Canada wide. The content we're doing is very Ontario specific. That being said, we are putting together a website. And it will house all of this information, and any frontline worker across Canada can certainly access that information. I would only caution that, especially with civil legal issues, the sort of administrative bodies and the way they do things in different provinces, it can be very different. So I would hesitate to say that it would apply sort of like across the board in Canada, but it can certainly be helpful for insight. I just wouldn't be using it for, accurate legal information if you're not coming from an Ontario perspective.
Yeah, that makes a lot of sense. Okay. Thanks. Leslie says thanks. Was there any other questions right now before Aileen continues with the presentation? No? Okay, well, we'll have another opportunity a bit later on. Thank you.
Awesome. Okay, so yeah, Leslie kind of touched on that, but I am just going to move into the next phases of our project. And like I said before, one of the findings that came out of our research was that justice-involved individuals are reaching out to trusted intermediaries in those moments of crisis. And so the next phase of our project has really been focused on how we can best equip frontline staff to help them support their clients in dealing with those civil legal issues. And I've sort of laid it out here in this diagram. I like to think of it as a three-pronged approach. It's sort of three parts to our next phase: the training modules, the resource hub, and systems navigation. And I'm just going to go over each of these briefly. So the training modules, what we're doing here is we've created modules and resources to train our frontline staff across Ontario. And again, this was something that came up in the research. As I mentioned briefly before, our staff was really interested in this additional training to help them gain that knowledge and help them identify or help their clients identify and address civil legal issues. And we actually just recently finished our pilot training with a few selective offices in Ontario, and we'll be aiming to do a full rollout of the training next year. Originally, the modules were intended to be delivered in person, but of course, because of everything happening with COVID, our plans were changed, and now the modules are going to be delivered online and have been so far online on an online platform, actually very similar to this one that we're using today. And we've built 4, but I'll say 3 sort of modules so far, because the income maintenance module is divided into Ontario Works and ODSP. But we have our housing and income maintenance modules, which again, that came right out of the research. Those are the issues that our clients are facing most frequently. So we wanted to start with those and get that information out at the beginning. And we've also put together a piece on trusted intermediaries, which I think is a really great introductory piece on what a trusted intermediary is and what their role is in these situations. It'll talk about things like distinguishing between what is giving legal information versus what is giving legal advice. And it also kind of goes through some of the things that trusted intermediaries can do to help their clients, and where trusted intermediaries can look for assistance themselves if they want help with these problems and helping their clients. And we're also hoping to add some modules as we go. So I've listed here a few at the bottom of the slide: employment, family law, school expulsion. So the employment and family law, we saw that came up in the research, and school expulsions, actually, that was one of the things that really came up from some of the community organizations that we chatted with. They pointed that out, particularly suspensions and expulsions, things about accessing the public education system. So we are hoping to do a module on that as well. And we're drafting some resources to kind of complement the modules as well. Things like quick sheets, tip sheets, things that talk about specific legal issues and kind of summarize the information a little bit more, just because we know that our frontline staff don't have the time to be sitting through a module every day, or kind of like trying to scroll back through a video and click on the specific time that something comes up that's talked about. So we did want to provide some summary documents and some information that they can maybe just keep on their desk, have access to on a more daily basis. And it kind of summarizes what the content is in the training modules. The other thing that I talked about briefly there was the website, or our resource hub. And essentially what the resource hub will be, it's going to just house all of this information. So it's going to house our training sessions, and it will also kind of centralize resources that are helpful. So there is, like I mentioned before, there are lots of resources available and information available for, particularly for low socioeconomic populations who want information or legal advice and things like that. So we are going to showcase that on the website and really centralize those resources, but we're going to have our training and our educational content, which is specifically geared towards community workers working with justice involved individuals. We're going to have that on there as well, because a lot of the workers that we spoke to mentioned that resources seem to be in a lot of different places, and they didn't have time to search through different pages, different links, different information. And so what we're trying to do is really centralize things on this resource hub, and have all that information be easily accessible to our frontline staff as well as other community workers. And I have later additions here at the bottom. We're hopefully going to include a forum for workers to kind of access different questions that have been asked and answers to those questions, but also be able to ask their own questions. If something comes up in the training module, they want a clarification, or they have suggestions on future modules or future topics, things that come up for their clients. We're always really eager to hear that. So hopefully we'll have some form of question bank or forum there. And we're also hoping to include what I like to refer to as like a choose your own adventure website, where workers can filter through different subject areas depending on the area of law that their client needs assistance with. And then it will prompt the worker with questions to help them properly identify the issue and triage that issue accordingly. And basically the idea of this resource hub is just really to promote the uptake of resources by our frontline staff as well as other community workers, by making it really easily accessible, making it content that's really easily digestible. So very plain language, easy to understand content, things that are very relevant to their work, and also very tailored to what they can do in the circumstances to support a client. So understanding what legal information in that scenario would look like and what they should not do in terms of giving legal advice. And the last thing is systems navigation. So what we're hoping to do is map out resources for our local offices and have them sort of have a, for lack of a better word, like it will be sort of a map of the different community legal clinics in their area and the different community support organizations, and knowing what each of those offices can do. and where frontline staff should be referring to. And this is going to really help our staff make those quality referrals, making sure the person gets to the right office the first time around to avoid those delays, to avoid that confusion that we talked about earlier. It's really about getting them to the right place the first time, particularly when they're in those moments of crisis. And we're really just trying to ease that process of knowing where to send your client. And the other thing too that we're trying to focus on is building those relationships with frontline staffs and community legal aid clinics, because we know a lot of the time it will be a referral to a legal service provider like a community legal aid clinic. So we're really trying to bolster those connections between our local offices and the legal aid clinics and promote that kind of warmer connection, warmer referrals for our clients, and just kind of get a better understanding of what each organization is doing so that they can have those mutual referral pathways. And the hope is by doing all of these things that our frontline staff and other community workers acting as those trusted intermediaries can then become allies to the legal community in Ontario. If justice-involved individuals can have that preliminary help in recognizing if they're experiencing a civil legal issue and being sort of helped in figuring out which issue it is that they're experiencing, as well as other compounding issues that might come up. So if our frontline staff can flag issues for that individual and let them know, okay, if you've been evicted, you might experience child custody issues, and just put them on notice to let them know about those other dominoes in the line. If I can go back to that reference, letting them know so that they can be aware. And once they kind of have that grounding information, then they can go on to look at which options are available to them to remedy that issue. And so frequently for our frontline staff, this is going to be a referral to a legal service provider. But we also know that that's not something that's always available. So we do have, some tips, some steps that frontline workers can use to help their clients in those issues if legal advice is unavailable. And again, the goal is just to create a more holistic approach to helping justice-involved individuals with their civil legal issues by, having these organizations come together to work together and create those mutual referral pathways to really make sure that justice-involved individuals are getting that quick access to legal services, to legal resources, to legal advice, because we know from our research they're not going on their own. So if we can have our staff act as those bridges and have them come in and really help the client get to the right office the first time, we're hoping that we can have this more holistic approach to addressing the issues. And with that, that's sort of the end of my presentation. I'm happy to answer any more questions. I've also added my email address here if anyone wants to reach out about the project, or if there are any follow-up questions, or just wanted to chat a little bit more. I should also, I do want to take this time while I can before we answer questions, just to thank Liz and Pinar for organizing everything and for inviting me here today to talk about this project. And I really want to thank all of you for your attention too. It's a really exciting project for us. And, we're really thrilled to have received this funding from the Law Foundation of Ontario and to have them on board supporting this program, because there's nothing like it right now that really exists in Canada. And we're really building a program from scratch. And we're building it to sort of focus specifically on justice-involved individuals in Ontario. And one of our hopes is certainly that what we designed can potentially be replicated and adapted elsewhere. So today was definitely a wonderful opportunity to kind of share this research and these next phases more broadly with you all. So maybe with that, we can take any other questions that came up.
Thank you so much. Yeah, just as you said that, I wondered if maybe we could invite you back in 6 or 9 months and you could tell us how things are going.
Totally. I would love to. I hope, our full rollout will hopefully have occurred by then. So hopefully we're doing an evaluation of the rollout as well, our pilot training. So we might have some more information to share.
And like the solutions that you provided to the research are so relevant. And I totally understand they are province or territory specific, but the model would be so valuable to, I imagine, all of the John Howard societies across Canada. So thank you.
Yeah, that's the hope. Thank you for inviting me too. This is, like I said, just a wonderful opportunity to share this a little bit more broadly outside of Ontario.
I'm so pleased to have you. Did anyone have any other questions? Michael has said great information. Thank you.
Thanks, Michael.
No, well, Aileen's been kind enough to leave her email address there. And as always, we'll make sure that this presentation is embedded into our blog, and we'll let you all know when it goes live. I'm immediately thinking of numerous people who I don't think could attend today, but I'm really going to encourage to watch your presentation. So yeah, thank you.
Awesome. Yeah, no, I'm happy to take questions about it whenever. So if you watch it 3 months from now, if you're watching this right now, 3 months from now, feel free to still email me.
Perfect. Thank you so much. Well, with that, I guess
Thank
we'll wrap
you.
up because I don't see any other questions coming through. But yeah, once again, thanks to everyone who's been able to listen in, and we will see you again next month. Take care, Aileen. Bye.
You too. Thank you. Bye.